Infection control during the COVID-19 pandemic. What you need to know. The best way to protect yourself and others is to understand how the virus spreads. Unfortunately, there is no current vaccine to prevent coronavirus disease. The best way to prevent illness is to avoid being exposed to the virus. The virus is thought to spread mainly from person to person, between people who are in close contact with one another, within about 6 feet, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Some recent studies have suggested that COVID-19 may be spread by people who are not showing any symptoms at all. Hand washing is the #1 way to prevent the spread of infection. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Always avoid touching your eyes, nose, and mouth with unwashed hands. It is important to use good hand washing technique to avoid allowing germs to remain on the hands. Use a clean paper towel to turn on the faucet and adjust the temperature. Throw the paper towel away. The water that is utilized should be lukewarm. Wet hands thoroughly, including the wrists, allowing water to flow from above down towards the fingertips. Apply soap and lather vigorously for at least 20 seconds. Get in between the crevices, between fingers, interlace the fingers, and rub the fingernails in the palms of the hands to get underneath nails. Wash hands for a minimum of 20 seconds. Rinse thoroughly. All soap should be removed. Dry hands well with paper towels, using 1 towel for each hand. Throw the paper towels away. Lastly, use a clean paper towel to turn off the faucet and open the door, then throw the paper towel away. You should wash your hands when coming to work and after your shift ends. After handling any contaminated materials, dishes, or surfaces. After touching your cell phone or computer. Before and after contact with your face, eyes, nose, or mouth. After blowing or wiping your nose, sneezing, or coughing. After using the restroom. Before and after eating your meals. After smoking or taking a break. And before and after using gloves. Remember to stay home if you are sick. Avoid close contact with people who are ill. Put distance between yourself and other people. Some people without symptoms may still be able to spread the virus. This is especially important to remember for people who are at higher risk of becoming ill. Everyone should wear a cloth face cover when they have to go out in public. For example, to the grocery store or to pick up other necessities. Cloth face coverings should not be placed on young children under the age of 2, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. The cloth face cover is meant to protect other people in case you are infected. Do not use a face mask meant for a healthcare worker unless you are using it in the workplace and it has been provided to you by your employer. Continue to keep about 6 feet between yourself and others. The cloth face cover is definitely not a substitute for social distancing. Make sure to cover your nose and mouth completely with a face cover to ensure that others are protected. In the office setting, masks should be worn in any common area, in any area occupied by another person, or when you are out of your personal workspace. If you are in a place where you are not using your face covering, remember to always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw the used tissues into the trash. Immediately wash your hands with soap and water for at least 20 seconds. And if soap and water are not available, clean your hands with hand sanitizer. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. It is our corporate office COVID-19 return to work policy that common surfaces must be disinfected after each use. Do not spray disinfectant directly on keyboards, screen, or phones. Rather, spray a paper towel first, then wipe the surfaces. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Then, use an approved household disinfectant. Leave sanitizing solution on the surface to be cleaned for 2 minutes prior to wiping off. Gloves should be utilized if there is an expectation that you will come into contact with bodily fluids or chemicals. Gloves should not be used as a substitute for hand washing. Even healthcare professionals are trained to wash hands both before and after using gloves. Familiarize yourself with the Justice COVID Corporate Office Return to Work policy. Per this policy, employees must keep a 6-foot distance from one another. Hallway traffic should be kept to a minimum. Employees must wear a mask when outside of their personal office space. There is a limited use of one person in the restrooms, copier rooms, and break rooms. There is a limited use of 4 people in the conference room and operations room. These rooms will be marked with appropriate seating spots. This concludes the Infection Control PowerPoint. Thank you for listening and watching, and have a great day.